Good afternoon, everyone, and thanks for joining our Australian Institute for Disaster Resilience second webinar in the series exploring the report, the 10 Years Beyond Bushfires, Mental Health Recovery After Disaster. My name's Andrew Coghlan. I head up the Emergency Service Program at Australian Red Cross, and I'm pleased to be your host this afternoon for what I think will be a really interesting and enlightening session. I'd like to start by acknowledging traditional owners of the lands on which I'm coming from today. In my case, it's the lands of the Wurundjeri people of the Coghlan Nation. I acknowledge the traditional custodians of the various lands on which you're all joining in from as well, and Aboriginal and Torres Strait Islander people who might be participating in the event this afternoon. I'd like to pay my respects to elders past, present and emerging, and celebrate the diversity of Aboriginal peoples, their ongoing cultures and their connection to the lands and waters across Australia, which are obviously such an important thing when we talk about all matters around emergency management and land management in particular. So much there is to learn. A few items of housekeeping before we actually get stuck into the content today. I'll introduce our speakers shortly, but just before I do, today's event will be recorded and made available after the event, so please be aware that that's the case. We'll be using the Q&A feature on Zoom to take questions, so if you have any questions, and I'd encourage those as we go, please type them into the Q&A box, not the chat window. The chat window is obviously still there and provides capacity to share any thoughts or reflections that you might have during the presentations. And if you want to share those thoughts with all the people on the call, you'll need to select all panelists and attendees in the drop-down menu so that everyone attending sees your messages. But just that reminder again, please put your questions in the Q&A section, not the chat section. As the questions unfold, you'll have the opportunity also to vote, to upvote if you like, by clicking the thumbs up button that you'll find as part of the menu. And then when we get to the question and answer section at the end of today's session, the last 15 or 20 minutes or so, I'll be able to prioritise based on the numbers of people who've supported the question or would like to hear the question asked. Also important, I think, to flag at the outset that the topic of today's webinar could be a little sensitive for some people. So we're talking about matters of mental health and matters of coping with the crisis that various people have been through. Or crises, I should say, over the decade or so since Beyond Bushfires work was undertaken. Important also, I think, to recognise for a lot of people, we're seeing more and more the strains of the COVID environment in which we're living. So we've provided some links to a couple of organisations there that you could access if support is needed either during the call or after the session. So both Lifeline and Beyond Blue, the links there, and I'm sure easily accessible phone numbers via those two websites. Enough of the introductory and administrative side of things. I'd like to get cracking with the program and introduce our two speakers. And what I'm going to do is to introduce both speakers at once. So we won't take a pause between the two presenters. Our first speaker, Meaghan, will hand over to Alex part the way through. And I really just wanted to acknowledge the fantastic contribution those two people have made to the Beyond Bushfires work and talk a little bit about what they're going to cover in the session today. So first up, Meaghan O'Donnell, who is Head of Research with Phoenix Australia, the Centre for Posttraumatic Mental Health that's situated with the Department of Psychiatry at the University of Melbourne. Meaghan's published widely in the area of post-traumatic mental health. She's the Research Director, as I said, with the Traumatic Research Clinic at Phoenix, I should say, which tests new and emerging treatments to promote recovery following a variety of trauma exposure. Meaghan is on a number of scientific advisory committees, including the 2020 National Mental Health and Wellbeing Survey, done by the Australian Bureau of Statistics, and the Australian Veteran Health and Wellbeing Advisory Council, a part of the Department of Veterans Affairs. Meaghan is also past president of the International Society of Traumatic Stress Studies and is a recipient of an Experienced Researcher Humboldt Fellowship. She's on the editorial board of the European Journal of Traumatic Stress Studies and has also been a guest editor on a special COVID-19 edition of their journal. Alexandra Howard is the Director of Disaster and Public Health Emergencies with Phoenix Australia, again aligned with the University of Melbourne. Alex has more than 10 years' experience in the field of post-traumatic mental health as a clinical psychologist, educator, and specialist in policy and service development. She's worked with disaster-impacted communities, emergency service and military personnel, traumatic injury patients, as well as the professionals who work and support them. Alex's current work focuses on translating evidence into policy and practice change that improves psychosocial outcomes for those impacted by disasters and public health emergencies, with a particular focus on marginalised populations. Alex has published in the field of post-traumatic mental health and has presented her work at national and international conferences. Just before I hand over to Meaghan, a reminder again, please put your questions, and we really look forward to some good discussion in the question and answer session later in the afternoon. Please put those questions in the Q&A section that's available to you on screen. Without further ado, over to you, Meaghan, to kick things off for us. Thank you.
Thank you, Andrew. And it's lovely to be here. Thank you for that lovely welcome. And I'm very excited to see the number of people who are signing in on the chat bar there. It's very, very exciting to see you all joining us. So thank you. And as Andrew said, I'll just be presenting the first part of today's webinar, looking at some of the results from the Beyond Bushfires survey. And then I'll be moving into talking about some current research that we're having, thinking about how we intervene to prevent the development of mental health problems after disaster. And then I'll hand over to Alex, who will speak more broadly about the program of research, program of training that we're delivering across Australia. So next slide, please. But before I do that, I wanted to just give you a brief introduction to Phoenix. So Phoenix Australia is a non-for-profit organisation, and our mission is to improve the well-being of individuals and communities who've been exposed to trauma. And as Andrew said, I head up the research portfolio within Phoenix Australia. Next slide, please. And Phoenix has 3 portfolios. So there's a research and evaluation portfolio. We do a lot of service and policy work, so helping organisations, government and industry to have best practice policies around looking after their staff and their clients who've been exposed to trauma. And we also have a training and education portfolio. And really what Phoenix does is develop research and then make sure it's translated into best practice and training. Next slide, please. So I'm going to speak to some of the interesting work we've been doing with the Beyond Bushfires study and really acknowledge all the authors on this work, especially Lisa Gibbs, who's headed up this research. Next slide, please. So as you are probably aware, and I know Lisa and Richard Bryant presented in the first webinar of this series, the rates of mental health fires is highly prevalent, and we see that post-traumatic stress disorder, depression, other anxiety disorders are elevated after trauma exposure through disasters, and it's particularly elevated in communities who have high exposure. Importantly, we see these rates of psychopathology or mental health disorders, they persist over time. Now, interestingly, it's not always the same person who has the disorder over this period of time. So here we've got 10 years of data. But you see that in the highly impacted areas, the rates of mental health disorders is about 20%, and that persists over time. Next slide, please. The thing that really interests me is these kind of trajectories of recovery. And what we know, and this is some latent trajectory modeling, what we know that over time there's different distinct trajectories. So what that means is that people's recovery takes certain groups of recovery over time. So our most, and you may have seen this before, our most common trajectory is that of resilience. So the majority of people who've been exposed to disaster or trauma recover over time, and that's the biggest group of people. And they're represented at the bottom line on this graph. The line at the top, represented by dots, that's the people who develop mental health problems after they've been exposed, and their trajectory is continuing. So they develop a mental health disorder or severe symptoms, and that's persistent over time. The group that's of particular interest to me is the group in the red the red square here, and that's the group that look like they're doing okay in the first few months after a trauma or after a disaster event, but gradually their symptoms accumulate over time. And this is particularly interesting to me because I think this is where we can target early intervention. Next slide, please. So what we did with the Beyond Bushfires study was look at the rates of adjustment disorder. And adjustment disorder is a nice way of capturing people with subclinical or emerging symptoms. So they don't meet criteria for post-traumatic stress disorder or depression or other psychiatric disorders, but they have emerging symptoms. And in psychiatric speak, adjustment disorder captures that group really well. And when we looked at the Beyond Bushfires data, what we found was that the rates of adjustment disorder, both at 3 years, 5 years, and 10 years, were elevated, and they were higher than the other disorders. So what that means is that people develop post-traumatic stress disorder or depression or anxiety disorders after they've been exposed to disaster, but a bigger group develop adjustment issues, and they are an important group for us to be targeting interventions to. Next slide, please. One of the reasons I think they're an important group to target is represented by this Sankey plot. And if you, the way to understand this plot is the green bar represents people without disorder. The dark blue bar represents people with a diagnosis. And the light blue bar are those people with adjustment problems. And we've got wave 1, wave 2, and wave 3 represented by these columns. And if we look at that light blue bar, what we can see is that there's a group of people who start off with adjustment disorders and at wave 1, and then 5 years post-disaster, they either have adjustment disorder or they've developed a more severe disorder. And that's about half the people. So half the people with an adjustment problem go on to either develop a more severe disorder or they maintain that adjustment disorder. And then we see that again at wave 2. So that's 5 years to 10 years. The people with adjustment problems at 5 years, about half of them go on to develop a more severe disorder or maintain adjustment disorder. So this tells me that intervening with this group is really important. Next slide, please. The thing that actually predicted whether someone was going to transition to a more severe disorder, especially post-traumatic stress disorder, were if they were female, if they had income stress, and if they had relationship stress. So here we can see that income support and relationship support for these people could actually help support their maintaining wellness and prevent them from developing a more severe mental health disorder. Next slide, please. So the question is what to do, and what I'm going to propose is that a low intensity intervention, because these people with adjustment problems don't have a serious disorder, and maybe a low intensity intervention could be really useful for them. And I'll explain what I mean by a low intensity intervention. That is a simple, brief, maybe skills-based intervention that is specifically designed for people with emerging symptoms. And Alex will speak to this model in a bit more detail, because it really presents a hierarchy of interventions for people, or you might hear it as called a stepped care model, where we target interventions, universal interventions to everyone being exposed to a traumatic event or a disaster. And the people who don't respond to that could get a more intense intervention, a level 2 intervention. And then for those who don't respond to that, would get a more formal psychiatric intervention. And so what I'm arguing today is that a low intensity intervention could be very useful for these people with emerging symptoms. Next slide, please. So that brings me on to talking about a particular program that we are currently testing. We've developed it and we're currently testing in rural and regional Victoria at the moment as a response to the bushfires that went through in Black Summer. This program is called Skills for Life, Adjustment and Resilience, and it's called the SOLAR program. Next slide, please. So the SOLAR program was developed by an international consortia who met together, and really the question, we kind of locked this international group in a room and we said, if you're going to develop a low intensity intervention, an intervention for emerging symptoms, and importantly, an intervention that could be delivered by lay people. If that was our focus, what would it look like? And we came up, after 2 days of deliberation, we came up with a set of skills that the group felt should be trained. And I'd like to acknowledge the Prince Charles, his charities. They supported the development of this. You can see Prince Charles sitting there at the round table. He certainly participated in this and is very supportive of this research. Next slide, please. So SOLAR is an intervention that we aim for it to be delivered by coaches. And so it's a kind of a wellness model in that lay people can deliver it. The coaches are trained. They go through about 6 months of supervision to deliver the intervention. And importantly, they're supported through that supervision process. And then they have resources of which the intervention, workbooks and things that can be delivered. So the coaches are really key to this. I'll speak a bit more about coaches for this current trial that we're delivering. Next slide, please. So what is SOLAR? What do we cover as a part of SOLAR? Well, it's made up of 6 modules. The first module is really linking physical and mental health together. And so we focus on improving diet, exercise, decreasing alcohol, increasing sleep, those kind of simple things, strategies about those things. But really it's just about linking physical health with mental health. If you look after your physical health, that will help your mental health. And there's a module around values-based behavioral activation, which is just a complex way of saying getting people to do the stuff they value. Often after a disaster, there's so much happening in terms of rebuilding and getting communities up and running again, that people stop doing the things they care about. And so it's really just encouraging them to think about what they value and making sure they schedule some time in their week to do those valued things. There's a section around for people who've been through a traumatic event or a very stressful event as part of that disaster. We teach people how to write in a narrative form about the disaster event that they've been through, and that really helps process the disaster event, and that can be very useful. There's a section on dealing with worry and rumination. So they're the kind of thinking that goes round and round, and it's not very useful. It can make anxiety and depression worse. So we've got some skills in there about how to manage that. And then we've got some skills around how to keep your relationship healthy, get it back on track, how to deal with conflict in a healthy way within a relationship. So that's kind of what solar is. Next slide, please. And so in terms of testing solar, we've done 3 studies where we've tested solar after disasters and other trauma. Originally we developed this and tested the feasibility and the safety of solar after the South Australian bushfires. And there's a link to the paper that was produced as a result of that study. We've listed that, or we've got that study up on the website that you can access. And then we've done a study in Tuvalu and one in Germany where we've tested it further with more sophisticated trial designs. And so it looks like we're developing a good evidence base to support the efficacy of solar. And now we're moving into some randomized controlled trials. We've got one with emergency services in New South Wales, and we will have one in regional Australia at the moment. Next slide, please. So I just thought I'd spend 1 minute talking about our study in regional and rural Victoria. So this is really looking at the communities that have been multiply impacted by disasters and trauma. So bushfire exposure, droughts, and of course COVID, and that really impacting people's mental health. And so we're rolling out solar in these communities. So one is to train up coaches in the communities, and then to deliver the solar intervention in those communities for people who are really struggling to recover emotionally from what they've been through. Next slide, please. So a little shout out here. If you're interested in becoming a solar coach, we've got a link, and you're in Victoria, we've got a link to that as part of this webinar. And also, if you know people who might benefit from actually doing the solar program as a participant, then they can register with this link, and again we'll have that available to you. I might leave it there, hand over to Alex, but I'd love to hear questions from you or comments from you after Alex's presentation, if you have further questions about solar or the more broader program of research that we're doing. So Alex, thank you. I'll hand over to you.
Thank you, Meaghan, and thank you for that overview of solar. And as Andrew and Meaghan said earlier, I will spend the next few minutes, I guess, putting the solar study in the context of stepped care or matched care, of all that hierarchy of interventions that Meaghan was talking about earlier. Next slide. So we've been fortunate enough at Phoenix Australia to be able to take all of the lessons from some of those Beyond Bushfires study that I'm sure you're all very familiar with, and look at actually trying to implement this post the Black Summer bushfires. So the aspect that we've been looking at implementing is being kind of community-led, locally led, and trying to build the capability or strengthen the capability really of people in the local areas to support their own community, to support their colleagues if they're in emergency services or even if they're in healthcare. So we've got a couple of projects currently going, funded by the Victorian and Federal Department of Health. And really the aims of those projects, as I said, are to look at kind of implementing all of that information that Meaghan was talking about around the hierarchy of interventions to support community members, to ensure the supporters themselves have some tools to, I guess, support them or reduce their chance of burnout, and support their colleagues and organisations. Next slide. So to put it all in context, so Meaghan did a deep dive on that middle step, the lower intensity psychological strategies. So the example that she gave there was around solar, but we do have another couple of parts of this hierarchy of interventions. And this has always been the recommended approach, but it's not often that we actually have the opportunity to implement this in response to a bushfire. So on that level 1, we have what's often called psychological first aid. So this is really simple, practical advice that is typically offered in the days and weeks afterwards, but really can be skills that can be applied whenever people are distressed afterwards. And then we'll have a group of people, as Meaghan was suggesting, that do go on to develop mental health disorders such as depression or anxiety or post-traumatic stress disorder. And they will need more formal mental health interventions. So that is where you'll hear the language of cognitive behavioural therapy or prolonged exposure if it's PTSD. So really the idea of this hierarchy of interventions is not, and I do call it the stepped care approach, but I realise that can be misleading. It's not that everyone needs to go through each of these steps, or you can't go and get formal mental health treatment unless you've had a go at psychological first aid. As Meaghan said, it's really, the step care approach is really about matching the need with the level of care. And what's really important for these is that whatever care or support we're providing to trauma-impacted individuals or communities, that we're doing that in a trauma-informed way. And I'll speak a little bit more about that. So you could almost consider that trauma-informed care, if that's a term that you've heard, wraps around this whole hierarchy. Next slide, please. So to give a little bit more detail on what we are currently implementing in Victoria and across other bushfire impacted states. So as I said, psychological first aid is what typically we call a level 1 intervention. It is informal, flexible. It could be something that you apply those principles in a 2-minute interaction, a 15-minute interaction, or you may interact with someone in a slightly more ongoing way, and you may continue to apply those skills. Really importantly, they can be it can be provided by anyone with some level of interpersonal skills and the appropriate training. And similarly to solar, where what's I think a real strength of something like solar is it takes the reliance away from the mental health care system or the more formal healthcare system. And it does mean that a lot more people in theory are able to become a solar coach and provide that support. So what's a little bit different about solar, as Meaghan was mentioning, is that is for those people that do need just that extra bit of support, but don't need to go into the mental health system. So it is more formal than psychological first aid. It's more structured. As Meaghan went through, there are sessions that and modules that you work through. So it is really more formal, but still has a level of flexibility built in. And then the top of that pyramid are for people who do unfortunately go on to develop mental health disorders or significant mental health issues. And that is where we would be trying to look at what resources there were locally to deliver those more formal mental health interventions. But obviously a lot of disasters can happen in those more regional and rural areas that already have some issues with workforce capacity. So that's why something like solar does have a lot of potential in getting people the appropriate help before they go on to need that more formal intervention. Next slide, please. So what is psychological first aid? I suspect many of you have heard about it. So I'll just speak through the principles. I think it's always really good to be reminded of the principles of psychological first aid, because it really is a do no harm approach. So if you have these principles in your mind in whatever it is that you are doing in your interactions with the trauma impacted or disaster impacted community, then you know that you're doing well by that person. So we want to be promoting the sense of safety, and importantly, that's not just physical safety, although that is a very important aspect. It's also psychological safety, really helping people with a sense of calming. So equipping you with the skills that if someone that you are talking to does become distressed, you feel like you have some skills, some strategies that you can use to help calm the person in the moment. Connectedness is obviously a really important part of recovery, and we know one of the strongest predictors of recovery. So your role in providing PFA is about linking people in with services or encouraging them to connect with their networks. I can't really mention connectedness without acknowledging the impact that COVID has had. And we are seeing that in the communities that we've been working with, that they're having to think really creatively, and they're doing a great job of it, think really creatively about how can we bring that sense of connectedness or the sense of community efficacy while going in and out of varying degrees of lockdown, or while our health service is really occupied with vaccinating the community. And then a final one there is a sense of hope. And I know that can feel difficult to hold on to that sense at time, but just in any interaction that you have with someone's been impacted by disaster, it's not about giving false hope or false assurances, but just I think of it as leaving the door open to things improving for that person. Next slide, please. And then Meaghan spoke about that middle level, and then, as I say, we've got that top level. So, in the case of PTSD, we've got some, very some NHMRC endorsed guidelines that Phoenix Australia has developed around what is the best practice for post-traumatic stress disorder. We've got things such as trauma-focused cognitive behavioural therapy, cognitive processing therapy, cognitive therapy, prolonged exposure, and eye movement and desensitization and reprocessing. So these are all interventions that do need to be delivered by a mental health practitioner, and that's, I guess, one of the barriers to being able to get that care is around having that capability locally. But it's worth being aware that is, if you were able to link people in, this is what you would be recommending that they would be getting if they were diagnosed with PTSD. Next slide, please. And then, as I said, to wrap around all of these interventions that we've been talking about, we're also strengthening the capability of people in the bushfire impacted areas to become more trauma informed. There's a lot of different definitions of being trauma informed. The way that I like to think about it is that it's really about applying a set of principles so that the interactions that you have with the trauma-informed person, the environment that you create for trauma-impacted people allows for their recovery, or at least isn't a barrier for their recovery. So it's not to do some training in trauma-informed care is not to become a counsellor or to change your role at all. It's simply thinking about, as my role as an administrator, as a receptionist, as an emergency service worker, what can I do as an individual, or what can we redesign as an organisation so we're not causing undue distress to these trauma-impacted communities. So the principles really are being aware of the prevalence and impacts of trauma, promoting safety once again, giving people an opportunity to rebuild control, because we know that's something that is typically taken away in the context of a disaster. Focusing on strengths, so realising that people are coming to you in their best attempt to cope at any given moment. They do have strengths to draw upon, and just making sure you have that as a starting point. Promoting connection once again, and a belief in recovery. Next slide, please. So as you can imagine, there have been some challenges in implementing this stepped care approach across Australia and Victoria more specifically. And I mean, there are a few on this slide to highlight, but one is recognising the impact on COVID, and not just the mental health impact, but the restrictions and the going in and out of restrictions that has makes it very complicated to help build the capacity in these regions. We do know that when we have been able to get out on the ground, people still find the training really relevant, even this long after the bushfires. We know that recovery does take a long time after bushfires, so it's still very relevant, and the skills that are covered in things such as psychological first aid really can be helpful for communities to have for future disasters, and also for the impacts of COVID. We also know that some communities, unfortunately, have been impacted by multiple disasters. So floods, severe weather events, on the background of drought, a looming drought, mouse plagues, and we have seen some communities grieving through a loss of life of young men. So there are many challenges that we're seeing in implementing this stepped care approach in the communities. Next slide. So just in summary, next slide, and you'll have a copy of these slides afterwards. So just reminding ourselves of this hierarchy of interventions, and we've spoken about psychological first aid being at that more universal intervention. Meaghan's given us some great background and context for solar and how it came to be, and the people that might benefit. And then, of course, we've got those more formal mental health interventions, and with trauma-informed, a trauma-informed lens across all of those. Next slide, please. A reminder of the supports and the training that are available through Phoenix. So this is just a plug again for solar, or for psychological first aid, trauma-informed care, or trauma-focused CBT. We're able to offer those at the moment to eligible people in various parts of Australia. So you're certainly welcome to go and have a look and see if you would like to access one of those parts of the hierarchy. Next slide, please. And another resource that we're looking to continue to promote across this year is the Disaster Mental Health Hub. So this is a really great resource, and I feel like I can say that because I didn't develop it. One of my colleagues did in consultation with the primary health care networks, and it has a lot of resources and videos, skills, handouts for use in all disasters. It also has a couple of short training programs in there as well for people to learn more about the impacts of disaster. So definitely something else to have a look at. Next slide. And just some final other resources that we have available through Phoenix. Next slide. I'd like to thank again the people who have been able to fund or support or partner with us in the work that we've spoken about today. That's really all from me, and I'm happy for Andrew to come back on and guide us through some questions. Thank you, Andrew.
Thanks, Alex, and thanks also, Meaghan. I think you would all agree, a really enlightening and insightful session. Both presentations really very valuable. An opportunity for some questions now, and I can see that in the Q&A section we've got quite a range of questions, which is great, a number of which have got multiple votes, which obviously strengthens them. And again, a reminder as we talk, we've got about probably 15 to 20 minutes left to take questions. So if you think of any as we're going with these questions, please pop them in and we'll see if we can get to them. So let's get the ball rolling, and welcome back to Meaghan again alongside of Alex. First one, I suspect, Meaghan, relates to you in that I think it came from your presentation. Can you please explain for us in a bit more detail what an adjustment disorder is or looks like, and particularly how it might be recognised in people in disaster-affected communities? And I suspect that's coming from people who are working in the field at the moment. What are some of the things they can be looking for around adjustment disorders?
Yeah, this is a great question and a really useful question. Look, adjustment disorder has a specific definition, but the way that I like to think about it is that someone has gone through an event and they're feeling like they're struggling in terms of their coping. So they might be able to still continue doing their usual activities, so still being able to turn up to work, still being able to manage a household, but they're finding it much harder to do than what they used to do in the past. So another way of thinking about it, they're getting a bit wobbly and just finding things that are harder than what they used to. The kinds of things I'd be watching out for is irritability. So they're more likely to get frustrated and irritable. You might see an increase in sleeping difficulties. You might see poorer concentration. So these kind of general symptoms are starting to increase, and it's starting to impact on the ability to function, but not so much that it's developed into a more serious disorder like depression or anxiety.
Okay, thanks, Meaghan. The next one could relate to either of you, so I'll leave it up to the two of you as to who wants to respond first, or perhaps you might both have some views. But there's a couple of questions being asked about proactive approaches to mental health care or mental health wellbeing, I guess. If the seasonal outlook for an upcoming summer has a high risk of fire, can you activate coaches to do preparation and preventative type works in exposed or potentially exposed regions and communities ahead of the summer season? I guess that's somewhere where a lot of people's attention is going as things start to get a bit windier, and presumably before long they'll start to warm up in places like New South Wales and Victoria in particular. So Meaghan or Alex, any thoughts on that one?
Maybe I speak to the research about this and then I'll hand over to Alex about the more practical things. So this is really a question about resilience building and how we can do that from a psychological perspective, so psychological resilience building. And to be honest, we don't have good research to show that we can do this. but it's the million-dollar question, and there's a lot of energy looking at how do we build psychological resilience. So I think if I was standing up here in 5 years' time, I can give you a better response than we haven't quite done the research. There's a lot of research happening to try and do this. And I am hopeful that we will be able to do, we'll have strategies to build psychological resilience. The main thing is, I have no doubt that learning skills in how to manage your sleep, learning skills in how to regulate your emotional distress, learning skills about self-care and self-nurturing and looking after your family. I have no doubt that those things are protective for people. It's just hard to find research that can show that to be the case. Alex, do you want to add anything to that?
Yeah, I think you're exactly right that it is the million-dollar question, really. So I guess we'll meet back here in 5 years to see if Meaghan's figured out the answer. I think from my point of view, one thing that I'm trying to focus on, so what typically happens post-disaster is that we roll out these workforce development trainings after the disaster. And as you can see, there's often quite a lag. So I think one thing for me, I'm trying to focus on, I know that psychological first aid and even the solar coaching in some ways feels like it's coming quite late after the 1920 bushfires, but it is about making sure we've got people in communities that do have some of this knowledge, these skills. So when the next disaster inevitably does strike, we have some way of almost activating that network again. I think until the researchers can answer that bigger question, I think for me, it's about finding a way to have it known within community, do we have a certain portion of people with these skills? Who are they? How could we activate that if and when needed?
Okay, thanks, Alex. And I'd refer to a question a little bit further down as well, or an observation from Glenn Davies, talking about the challenges in getting people to turn up for Red Cross Ready Plan sessions in communities after a close call in January 2021. It's often not just psychological preparedness, but general preparedness. Getting communities and individuals motivated to do something is one of the great challenges, I think.
Yeah,
right.
I would agree, Andrew.
Yeah, and one that I'm sure will get a lot of exploration in other AIDA sessions over the coming months and years, potentially. Particularly, one of the things from a Red Cross point of view we've been looking at is whether behavioural economics is an area that could potentially provide a few clues on how to motivate people to think about things that aren't incredibly likely to happen, but when they do, cause a massive impact. So moving through the questions, another one is around, can we build trauma-informed first responders so that the care actually starts at the earliest possible intervention point? Alex, any thoughts on that one?
I'd like to say yes.
Yep.
It almost goes back to that earlier point. I want to be upskilling people now ready for the next disaster. Obviously, the funding bucket typically comes from the last one, but I think it's about motivating people, even if they weren't directly impacted last time, to see the value in becoming a trauma-informed first responder. So we are doing a lot of work with emergency service personnel, and we're trying to think of emergency service and first responders very broadly, because we know in those smaller communities, the line between first responder and farmer and community impacted individual is very blurry. So I think, that's a great ambition and an idea that this person has put forward. I think the other point to make about being trauma informed is not just as an individual, but as an organisation. So thinking about, as an organisation, are we making people jump through hoops to access the support that they need? I would love, for example, insurance agencies to be trauma informed in their interactions with community members and things like that, or medical receptionists, equipping them with some skills because they're no doubt dealing with very distressed people. So I do think there's a lot of potential. But yeah, the idea of having those people upskilled so that we can be doing something in a trauma-informed way from the earliest point.
Yeah, good answer. Thanks, Alex. And I think really highlights that there's a lot of people who are on the front lines without really knowing it during times of disasters. I know, people who run post offices and local general stores, pubs often become the epicenter of a lot of conversation post a disaster. And for them to have that sort of insight and skill would obviously help as well.
Yeah, definitely.
Okay. The coaching, there's a few questions around the coaching. Do the solar coaches tend to be volunteers or paid employees of different organisations? Is there any right or wrong way of doing things from that perspective?
At the moment, solar is being rolled out under an evaluation, within evaluation studies. And in those studies, people either get trained to deliver solar as part of their current employment. So whether it's a community nurse, for example, is trained up to deliver solar, and she does that, or he does that in the work that they're currently doing. And other people do it from a volunteer perspective. So you can do it if it fits into your current, the current work that you're doing, or you do it as a volunteer. Okay. We have both, yeah.
Yep, so no right or wrong there. Thanks, Meaghan. Question there around whether solar, the development of it, has been informed by community development principles. In other words, were involved communities consulted in developing the work?
Yeah, look, this is such an important question. So thank you for asking. I feel like someone's planted that question. The thing about solar, which I feel very, very strongly about, is that it needs to be culturally adapted depending on where it's being implemented. So part of the reason we developed solar in the way that we did was it allows for people to culturally adapt it so it fits in into the population where it's going to be delivered. So for example, in Tuvalu, we went through a long process of cultural adaptation to make sure it's delivered in a way that was acceptable to the Tuvalanese, what do you call when you're into it? Tuvalanese, I think it is, to the population there. And so it was delivered by pastors, it was delivered in a group cultural way, and other aspects were changed to fit the culture. So that community collaboration, community input and cultural adaptation are fundamental to the solar program. Okay,
thanks, Meaghan, as they are to any good recovery work, I guess, in broader terms.
Yeah.
A question, I think a really interesting one along similar lines, around whether or not Aboriginal ways of knowing, being and doing were a consideration or are a consideration in putting solar programs into practice.
Yeah, look, this is a really important point, and to be honest, we haven't culturally adapted solar for Aboriginal populations. We would want to do this, and we want to do it properly. And so at the moment, the current round of funding for solar, we're testing it in rural and regional communities without having a specific adaptation for Aboriginal populations. But we certainly are looking to get funding and partnerships to develop a version of solar that will be very highly relevant and culturally appropriate for Indigenous populations in Australia.
Okay, thanks, Meaghan. Alex, one for you, if I could. The need for connectedness. You talked about some of those aspects of psychological first aid, and one of those was connection. Can you give us some examples of the need for connectedness and drawing people together, and how that balances with the current challenges of the COVID situation, where obviously people are in a lot of places are being confined to home or pretty close proximity? Is there any way of balancing those two things effectively, do you think?
Yeah, and it is a tricky one, definitely. I think the first point to make is to really think broadly when we think about connectedness. So not just to think of connectedness as having someone to cry on the shoulder of, or to, you know, give a hug to, but it's about having that person, but also having a mate that you would talk to about anything but all of the bad stuff that's going on currently. It's about thinking about what practical help you might need. For example, childcare would be very handy for some people at the moment, if that were allowed. Also, what practical help you can offer other people. I think that's a really important part of our connectedness as well. And then thinking of those connections that are more at the community organisation or service level. So I think, I mean, communities that I've spoken to are actually doing a really, really great job at adapting. They're, when the restrictions allow it, there are barbecues, there are balls, there are events, there are donut deliveries, all sorts of things. And then when those things are shut down, they are looking at other ways to keep the groups connected, and not just all through Zoom. So I think probably it is, I think there's no straight answer, basically. I think it is about kind of problem solving with your community. You know, are your community members tech users, Facebook users, Zoom users, or is an essential donut delivery more viable at this point? So yeah, but to think really broadly about it, first of all, and then I think that will give you more options to play with in getting those connection needs met.
That's great. Thanks, Alex. And I think really highlights the importance of creativity in all our recovery work. And just one last one to finish on, which is perhaps part question, part observation. But at what point does the presence of positive psychological aspects, such as post-traumatic growth, coping and resilience, counterbalance the symptoms or potential symptoms of PTSD?
Yeah, so just quickly, post-traumatic growth and trauma difficulties such as post-traumatic stress disorder or depression, they can run side by side. And in fact, there's a high correlation between post-traumatic growth and PTSD. And what that means is that people can experience trauma and see and experience difficulties with that trauma from an emotional perspective, but also can see how the trauma has changed them in some way for the better, whether it's around relationships, whether it's about appreciating various aspects of their life. So it's important to acknowledge that there is growth that happens alongside of dealing with the emotional consequences of trauma.
Okay. Thanks, Meaghan, and thank you to both you and Alex for the fantastic presentation and the really engaging question and answer session. It's been great to hear from our audience what it is in particular they've been interested in. That's all we have time for, but in thanking our two presenters, I'd also like to remind people that there's still 2 more webinars to come as we explore a little bit further the 10 Years Beyond Bushfires Report. So the next one is on Wednesday, the 22nd of September at 2 p.m. And we'll look at social networks and disaster resilience with Colin Gallagher in particular. So on behalf of ADA, I'd like to thank you all for joining us today. We'll send you an email once the recording is done from today's session, and that'll be live on the Knowledge Hub, so you can access it again if you need to. When you exit today's Zoom session, you'll also be asked to complete a short survey. We'll use the information in that to ensure that our ongoing professional development events program through ADA continues to meet people's needs. It's been a real pleasure to host the session this afternoon. Thanks again to our 2 wonderful presenters for not only their presentations, but the work they do. And until next time, we wish you farewell and stay safe in these challenging and tricky times. Thanks, everyone.